Hello everybody, it's a pleasure to be with you. When VFS Global invited me to speak and the team briefed me on what you all do for a living, I could only imagine what an incredibly difficult job you must have had over the past year, dealing with an environment of upheaval and constant change in order to tackle the COVID crisis. From taking a look at the evolution of the crisis, the main question we've been pondering is this: is there a better way to do things? And that's what I plan to discuss now. As you know, the airports are empty, and that means no revenue from visitors. It's becoming increasingly clear that the question of pandemic management will become a major challenge for border security. In reviewing the progress of the pandemic, we noticed that public attitudes in many countries are that the government has been on the back foot. It struggled to cope with COVID-19 because it should have known what was about to happen and it should have been more prepared. Let me illustrate. Last year, when the pandemic broke, there were inadequate supplies of masks and other personal protective equipment. Soon after, many countries introduced digital tracing. This was a brilliant idea, and it still is. But in several liberal democracies, concerns about civil liberties caused it to fail. That was an ironic tragedy, because the result was an even greater invasion of civil liberties, with lockdowns and closed borders, all because we were not able to trace. Interestingly, consumer sentiment has since changed, and people would now make the trade-off and accept greater intrusion if it enabled them to move around more freely. In another early measure to fight the pandemic, governments imposed strict movement restrictions, quarantine and test regimes, and they promptly decimated the travel industry and most damaged their economies. And now there are vaccinations. They're supposed to fix everything, but they can't, because they're in short supply, because they take time to roll out, and because the virus is mutating. Vaccination will be an excellent long-term strategy, but the more we understand vaccines, and in particular that whilst they lessen the symptoms of COVID-19, they don't stop people spreading the virus, the less they're the miracle solution that will get life back to normal immediately. Another strategy is mass testing, but the costs are astronomical. Think about a country with 80 million citizens. Let's just say 40 million are active and they need to be tested twice a week. That's 40 million times 52 times 2 times 5 on the basis that each test costs €5. That's over 20 billion euros a year for the foreseeable future. It's crazy money, and that doesn't take into account the cost of the staff giving the tests. What's clear is the current measures are unsustainable and a better strategy is needed. But where to start? There's one issue that doesn't change and has not changed over all this time. It's risk. The risk of you becoming infected yourself, the risk of infection, and the risk of infecting other people, the risk of transmission. Risk is our starting point, and I will come back to the subject of risk shortly. But now, as all of you are acutely aware, all countries need visitors. They don't just pay visa fees, they're vital to the wider economy, but no country can allow them to derail its efforts to keep the pandemic at bay. Conversely, nations also need the people leaving their shores to be seen as safe, so their citizens can get back to travelling too. When it comes to border security, we have the visa system to ensure visitors are not a security risk or an economic risk. There's no reason why countries can't take a similar approach to health risk, and they can say to visitors, if you want to come, here's what you have to do. However, what I'm advocating is that countries should go further than demanding to see vaccinations and test results. It's perfectly reasonable to insist that visitors are also traceable electronically, so their risk of catching and passing on COVID-19 can be monitored and the spread of the disease can be curbed. It's not difficult. They just need to have a digital device like a mobile phone, which nearly every visitor has already anyway. But being able to be traced is not just about knowing who's been in contact with who in the event of infection, it's more fundamental. And now we're back to risk. When people interact with each other, they give risk and they receive risk. People arriving from a country where infection rates are high, where the virus has been spreading fast and there is a vaccine-resistant mutation, are much more risky than people coming from a country where there's effectively no COVID-19. The point is, once visitors can be traced, their personal risk can be calculated. If their personal risk score rises too high, for example because they're gregarious, they've come into contact with a lot of other people, they need to be tested. In the language of epidemiologists, this is essential action to prevent superspreading. Now, if they've been vaccinated, their personal risk score will remain low for longer. If their vaccination is ineffective against local mutations, their personal risk score increases. And as new data is discovered about different vaccines and the progression of the disease, that information can be factored into the calculation of risk scores. Right now, I understand that many border forces around the world are looking seriously at testing and vaccination. What I'd like to know is how many are thinking about tracing and risk. And if they are they also planning to require their visitors to take an additional test if the visitor's risk level becomes too high? Now, if countries take this approach, they will be doing something really valuable. They will be offering proactive protection, which is so much better than reactive tracing. Prevention is better than cure. Managing the border would be much more straightforward. Immigration officials would no longer need to apply an increasingly complicated and ever-changing list of rules. A scanning app would simply check the devices of visitors to make sure they were displaying a bona fide QR code or green symbol. And by the way, travel providers could also have the same capability. With that strategy, one can also minimize the cost of any regular testing because it's only necessary to test people whose personal risk score has been elevated. Furthermore, there's no question of discriminating between vaccinated and unvaccinated people because one can ensure that their personal risk score is kept the same low level consistently. Of course, if countries take this responsible, proactive approach to keeping the personal risk scores of the visitor population down, they will become a safer and more attractive destination to visit. And that means revival of the visitor economy. If this strategy seemed to work well in managing down the risk of the visitor population, it won't be long before the local population also wants it. So here's the real message. If border forces embrace this strategy and demand this kind of risk-based approach to managing the border, they won't only be responsible for reviving the visitor economy, they will be instrumental in reviving the domestic economy too. Finally, if anyone is interested to talk more about risk scoring visitors, you might be interested to know that OK2Roam is not just in step with the approach called for by WTTC, it's ahead of it. I say that because we have already built all the necessary back-end systems and they're running on a well-proven AI-enabled technical platform. So we could provide a demonstration, computer simulation, or even facilitate a trial. If you have any questions or want to talk about the subject in more depth, please reach out to your regular VFS contact. Thank you very much for your interest.